to discuss how to avoid disciplinary action by the board. Important topic that if you're a physician or a medical provider, I'm sure you know of someone that has gotten in trouble with the board. And so we have a few do's and don'ts. Let's start off with number one. Please don't prescribe medicines to your employees. Now let me qualify that. When you work in a large practice or maybe even a small practice, there are times where your employees may come to you because they need a prescription for cold medicine or they need a prescription for nausea medicine. If it's an emergency and they cannot see their provider, which is what I would suggest you tell them to do, go see their regular medical doctor. But if you think that you can help and it is an emergency or it's not a narcotic as a controlled substance and you want to give them a prescription, I think you can, but you will have to, the appropriate thing is to document that you've done this and make sure their provider gets a copy of the prescription or a note stating that you did this. So overall, I would suggest you avoid doing that because you can get into problems where now they think, okay, she did it before or he did it before, so I'm going to come back to him the next time I need something. And sometimes these medications that you are giving, let's say cough syrup frequently, might be abused or inappropriate and their regular family provider doesn't know they're getting this on the side. So I would definitely recommend one way to avoid getting in trouble is not to prescribe medicines to your employees. The second rule I would tell you or don't is avoid having relationships with your staff and definitely your patients. It's all about being professional, and you would think that this is a given, but how many times have we seen write-ups or heard stories of providers, doctors having relationships with their patients?
Yeah, that's where they ended up getting a suspension in their license, or a worst case, or even a public letter of concern. But
right.
Yeah, that's just a big no-no.
So major no-no. You've put so much work and energy into getting your medical license. Why would you risk losing it all by having a very unprofessional relationship with a patient or staff? The third don't that is very common is prescribing narcotics to yourself or to family members. And when I say narcotics, I mean controlled substances. Again, to family or to employees or to yourself is a major no-no. It's very easy when you get into this business to feel a lot of pressure from people that you see on a daily basis. You know, they think you're a doctor, you should be able to give them medication. Why should they have to go take time off to see their regular doctor? You know, you're my cousin, you're my brother, you know, you're my uncle. Why don't you just give me a prescription? You're a doctor. And many people feel a lot of pressure and will go ahead and write that prescription one time, you know, thinking no big deal. But it is a big deal. We are not supposed to prescribe medication for our family or friends. And we need to convey that to them. And even I've had times where family have asked, you know, for me to write a prescription. They were on vacation, but I had to tell them, unfortunately, it's not appropriate for me to do this. Another area or major don't is drifting. And this is when you are prescribing or practicing in areas that you were not trained to do. And part of that, why would the doctor do that? Well, there's a lot of pressure to make money, a lot of pressure to see more patients, to generate a higher income. So you find doctors that are doing things that they were not trained to do or not supposed to do, but they do it anyway. hoping that nobody will find out, nobody will pay attention, and they won't get in trouble.
Yeah, you have doctors because under pressure, with cash flow and in a competitive environment, try to do other things. They also get, we get faxes constantly about cosmetic workshops, teaching you how to add, more on your cash flow, or sign up to get a new machine that will add more billing and stuff like that. Well, but what the hidden things that's implied in that is that you may bill it. Most insurances will not pay for them. So that means that you're going to be billing the patient, and you're going to be charging for things that really, at the end of the day, is it adding to the quality of care? And that's the bottom line. Whatever are you doing, is it adding to the quality of care? And sometimes the pressure is so great, that you rationalize, say, well, if there's no harm or it's not doing, what if I'm adding a few hundreds to thousands of dollars to my bottom line? But so many examples are out there that it shows that it will catch up to you.
It will catch up to you. It's so not worth it. I've seen so many providers claim that certain injections will promote weight loss or give you energy, or there's so much out there. Providers doing procedures they were not trained to do, all to make an extra buck. And it is a huge risk. It's a huge risk that unless you're trying to have a board action against you in the near future, I would strongly avoid it. Go back to school if you need to, and get the training that you need. Go back and get board certified in some specialty that you want, instead of drifting and doing things that are not designed for your practice, or not appropriate based on your training. So we can now talk about some suggestions, basically positive things that I would suggest you do if you're trying to avoid disciplinary action by the board. Number one, I would definitely suggest you take an ethics course. So the best time to take an ethics course, I believe, would be in medical school, but if you can find one in residency, a medical ethics course, that would be great. I took a medical ethics course, and I don't know that alone is responsible for me making moral decisions or appropriate decisions, but I certainly think that it helped. What you will find when you start practicing is there are a lot of smart people out there. There are a lot of book smart people, people that can take tests really well, people that are incredibly amazing at retaining a ton of knowledge. And yet those same people are morally corrupt. And I know we are not used to hearing that doctors can be morally corrupt because we were trained or supposedly trained to do the right thing. But it's amazing how many doctors out there are doing inappropriate things in their practice with their patients. So I really encourage you to take an ethics course whenever possible, because this will help you stay out of trouble.
And your staff.
And your staff, if
See,
possible.
that's the thing, because in the end, it's not just you, but it's also your staff. So if they're behaving unethically, whether it be overcharging patients, whether it be taking samples from the sample closet,
Right.
Basically.
We've had to let go. We've had to let go staff that we found out had drug problems. It's sad, but it's true. Where there was absolutely no level of trust, because how do you work in a medical practice and have someone stealing medications from you? Or at least it's not ideal. And unfortunately, this is the environment that we live in.
Well, so it's important that they need to get the help they need, because it's just like, you don't want to put someone in an environment that's, just like an alcoholic in a bar. You don't want to have an alcoholic work in a bar.
Right.
It's the same as someone with a drug problem. shouldn't be in a medical clinic with access to medications and drugs. So
Another suggestion I would have for you is please learn to say no. And I think this is very crucial because as doctors or as medical providers, we are raised to please and to help our patients. We're in the business of taking care of patients, making them happy. But unfortunately, what you will find is that certain patients will push you to do things that are inappropriate. Certain coworkers, certain staff will push you to do things or encourage you to do things that are inappropriate. So you have to have boundaries. And that comes with having a strong sense of self and moral compass, if you will. You have to learn to say no and not feel guilty about it. You're not there to be their friend. I am friendly, but I am not my patient's friend. So when they ask me for pain medicines that I don't think they need, or when they ask me for weight loss medicine that I think they're just using to get energy and not to actually lose a pound, I'm going to say no. And at that moment, that patient is upset with me. Now, for a different provider, they are uncomfortable saying no. They want to make that patient happy. My license is more important to me than pleasing a patient when I know that I'm not doing the right thing. So I'm constantly thinking about do no harm. That's what I'm here to do. Do no harm. So if it means saying no, then that's what you have to do. Say no. Another suggestion I would have for you is to take a self-prescribing class. And that's becoming more and more, commonly encouraged. Because of the epidemic of narcotic abuse, for many reasons, it's very much something that you should be aware of, and I would definitely recommend taking a safe prescribing class. You can get CME you can get CME taking a class in this area, and I would definitely recommend it.
Check with your medical board, because some medical boards now are taking the changing the rules. For example, in North Carolina, is now going to be a requirement that doctors take a class in prescription ethics and also controlled substance prescribing, and that's going to be mandatory, as based by the state legislature. So many states are starting to do that now, making it as part of the mandatory credentialing and the CME requirements for doctors as well. So check with your local medical board and see, but it's best to get ahead of the curve and see what is being offered out there. But it's coming down the pipeline where it's going to be mandatory in, if not all, but most of the states, that something of that sort for controlled substances.
And another suggestion or is practice defensive medicine. And what I mean by that is always think about the potential for a lawsuit. Always think about the potential for your patient claiming you did something inappropriate. So I'm always thinking about documentation. If you did not write it down, or if you did not document it on your EMR, it did not happen. It's your word against the patient's word. So I really suggest that you get on top of your documentation and practice defensive medicine when it comes to all of your interactions with your patients.
And it's not only just the doctors, staff should also document as well, especially phone calls. Any type of phone calls that also deal with high risk, for example, chest pains,
pain, GI bleed, stroke symptoms,
just anything, or even behavior that alter mental status. I mean, anything that's a high risk, you should always constantly document. Even strange requests, you want to make sure. Also, hostile patients, you want to document constantly, or even hostile family members. Because sometimes it's not the patients, it's also you have third parties that want to interject themselves into the process that they don't have any right to. No, non-custodial individuals that don't have custodial care of the patient.
Right. I also need you to understand that sometimes, despite your best efforts, patients can be unreasonable. And even when you think you're doing your best and have done your best, someone may still turn around and file a complaint with the medical board. And as long as you have done your best and have documented appropriately, hopefully things will be okay. But just be prepared that sometimes patients whom you want to help may sabotage that relationship, may sabotage their care, may be inappropriate, and yet you think you did your best. I've had a patient complain that she was turned away from our practice and subsequently had a medical problem, despite her story being completely different than what actually took place. And in that case, the medical board did not find anything, any wrongdoing on our part. So it was very upsetting. And I know I am not the first doctor or last doctor to have ever had a complaint from a patient, but I still count my blessings that in practice of over 10 years, that was probably the only patient. And in that case, it was not...
it was unfounded, yeah.
It was unfounded and not something that ended up being on my record at all.
Right, and but the thing is that it is frustrating, especially we're in the age of social media and Yelp, which again, that's a whole other discussion.
Right.
Where you want to rate doctors up to 5. But the thing is that if the doctor do no harm, that's where you're going to say no. Hey doctor, can I have some pain medicines? No. Oh, you're a jerk. I don't like you anymore. You know what? I'm going to go online and tell everyone you're a lousy doctor. Why? Because I didn't support your habit?
Right.
Or, hey, I want some weight loss medicine, some phentermine. Why? To lose weight? No, because I like it because it gives me energy. Well, that's not what it's for. It's a form of speed. It's a controlled substance. Oh, you're a jerk. I'm going to go on Yelp and tell everyone how terrible you are.
So yeah, that I wasn't planning to talk about that, but those online reviews, I think right now in today's day, I think they are so unhelpful.
It's garbage.
All they are a means for patients, disgruntled patients who didn't like what you did for them or didn't like something that you didn't do, go out there and write crap about you. I really don't think it's a good indication of how good a doctor is. Just like you might go online and find reviews written on bad doctors saying they are great, they are wonderful, 10 out of 10. So another suggestion is to treat your patients the way you would like your family members treated. And that seems pretty basic, but I think a lot of physicians get into that work mode and forget to be sensitive enough and treat their patients as if they were family members. You have to do your best to make sure that you are professional, you are kind, you are attentive. The patient is exposing a large part of themselves to you. They are often sharing confidential information with you. And so please give them that time, or at least give them the sense that you are listening and attentive to their needs. Because a patient that feels that you care and feels that you are attentive is less likely to sue you than a patient who feels that you were dismissive, didn't care, weren't listening. So do your best to be caring and kind with your patients, and above all, professional. So the last point I would like to make is please do get familiar with your state's medical board. If you want to learn about all the regulations that are out there and ways to avoid getting in trouble, or you have a question about discharging a patient, or you have questions about the appropriate way to do a physical exam even, or the appropriate way to close a practice or retire, please go to your medical board if you would like more information.
But also another good source is actually your malpractice. Almost all malpractice insurance will also have training, and they also offer the training to also help reduce your costs as well, because as part of their defensive medicine requirements, if you take certain courses or you have your staff take the courses, it can also reduce your malpractice costs up to 5 to 10% depending upon the insurance policy. So take a look at that. But they also offer that as well, and also offer benefits in reducing costs. So look at your, because it's in their interest. Because if you get sued, guess what? They don't have to carry the burden as well as settlement costs. So it's a win-win for both parties. So take a look at also at your malpractice insurance carriers' requirements as well. If they don't have that, it might be time to shop around for a better carrier.
All right, so I hope you have found this helpful, our list of do's and don'ts on how to avoid disciplinary action by the board. We hope that this was again informative, and we hope that you will check out our other videos. If you haven't already looked at our clinic tour, please go ahead below and find it. And also, if you haven't subscribed, please go ahead and do that. We hope you will come back, and thank you.
And also, any topics you're interested in and so forth, just send us a little shout out, and we're more than happy.
All right, so all right.